In Singapore, there seems to be less people with high arch feet compared to those with flat feet. That does not mean that those people with high arches have less foot problems than those with flat feet. High arches are termed Cavus feet. They are often more rigid in structure, commonly misunderstood, and can be more difficult to treat. Many patients with high arch foot problems try to relieve pain with a generic insole into the shoes. This can worsen the problem by making the feet more unstable on the outer or lateral border and lead to more serious foot conditions. There are different factors that can cause high arch feet, including hereditary and neurological conditions. Typically, conditions such as Charcot-Marie-Tooth or clubfoot deformity present as high arches. The long-term impact of Cavus foot is that the person is more vulnerable to certain overuse injuries during sports, exercise, and even during their daily activities. The person would balance on only 3 main areas: the 1st, 5th metatarsal heads, and the heel. This makes the Cavus foot a less efficient shock absorber while being placed under constant tension. Symptomatic or painful high arch feet often present with the following: pain along the lateral column of the foot due to joint degeneration, periostitis, capsulitis, tendonitis, bursitis, and neuritis. Ankle instability and the tendency to suffer ankle sprains. Pain under the 1st metatarsal, which may be a sesamoid fracture, sesamoiditis, osteoarthritis, hallux limitus, tendonitis. Plantar Fasciitis, due to the constant tension exerted on the plantar fascia and the Achilles. Metatarsal and lateral column stress fractures. A collapse of the foot structure due to the high arch becoming flattened. People with high arch foot problems would need a thorough biomechanical assessment before undergoing any treatment. Any neurological component would suggest a more severe condition. The patient would be advised accordingly and referred to the relevant doctors for further diagnostic investigation. In general, the best preventative treatment is to have children's feet checked before the age of 8 to ensure they are developing correctly. Conservative treatment often involves custom foot orthotics for realignment and offloading of the feet. These should be designed precisely to the person, because Cavus feet are less adaptable than other foot types. Even 1 extra degree of angulation can affect the knees, hips, and spine. If pain is present, then additional therapies may be required to heal the injury. For more information on related conditions, check out our other videos.